Hey, good afternoon. This is Edward Reyes as your personal injury attorney. Today I have a special guest, Dr. Marnie Bauer. She's a dentist here in South Tampa, and she's going to talk to us about some issues that come up whenever people are involved in an auto accident. She's a specialist when it comes to TMJ disorder and other things as well. So please introduce yourself.
Hi guys, I'm Dr. Marnie Bauer, and I have a cosmetic and family practice here in South Tampa. And I'm here to answer some questions of Eddie's to educate you all.
So as you guys know, whenever people are involved in auto accidents, tons of different things are going on. So we're going to cover TMJ specifically today, and please elaborate, what exactly is TMJ?
Okay, so I will say that first and foremost, TMJ is a very gray zone in dentistry. It's very difficult to diagnose, but I am going to use this skull actually to show you what TMJ is and explain to you about what the syndrome is. So, the joint is actually between the jawbone and the skull, and the joint here lubricates the muscles and the bones so that when you open and close, everything can hinge healthy. So whenever there's trauma caused to this by a car accident or a fall, exactly. Yes, this jawbone can become dislocated like this, and also this is a really good view to choose this. So this yellow joint here then can become displaced when there's trauma, and that can be very, very painful, and it's very difficult to diagnose.
Now, what type of pain, because TMJ, and thank you for the great motto and showcase.
I knew you would like that.
I do, thank you. So what type of pain does somebody actually feel whenever, what should they be looking out for?
Okay, so first of all, there's a few things. There's tinnitus, which is ringing of the ears. So some people think that they may have an earache.
I didn't know that.
Yeah, and that's tricky. They go to their ENT and they think that something's wrong with their ear, but it's actually the joint space. Their muscles can be so tense that their whole face, patients complain that their whole face is in pain, and they can't really pinpoint the area, but their whole jaw is sore. Some other pain can be headaches, migraines. These can trigger migraines.
Okay.
And so again, it really is, the joint system is very delicate and complex. So whenever the muscles are involved and they're constricted, it can cause a lot of different types of pain.
So explain to me this. So most auto accidents, not all of them, but a lot of them, they get rear-ended from behind. So it causes more of a whipping action, like whiplash.
Right.
What would cause the jaw to actually move? Is it the force? Is it...
Okay, so let's think about this for a second. When we are in different positions, even when we're sitting straight up, everything is balanced and our muscles are balanced. But even if you're just looking down, and a lot of people that work looking down, either being surgeons or dentists or dental hygienists, or people that do a lot of computer work, even if you tilt your head and relax it, you can notice that the muscles relax and your whole mandible moves forward. Okay, and so when you have that trauma and you're hit from behind, it's the muscles that are moving and become so loose and jarred that it dislocates this whole joint here. So this kind of position happens and occurs, and it will not slide back. So you've got this imbalance, if you will. You've got muscles constricting and contracting here and muscles pulling here, and until those muscles relax, the mandible will not fall back into its eminence.
So it's kind of like a reflex action. So what you're saying is that when driving, your jaw is a little bit loose, and then when it happens, it tightens up. I would imagine from like a muscle, for example, like when you're working out, and then it contracts, and then that's when you have the pain.
Yes, and it's a hinge.
Okay.
Okay. So the joint is a hinge axis joint. So it's very complicated. So the only thing keeping it attached to the skull are the muscles. So if you've got that jarring impact, your muscles are relaxed, everything moves and causes the bones to move with it.
And doctor, tell me, what are the common treatments for TMJ disorder? When somebody comes to you with pain, what's the next step? What happens next?
So remember in the beginning I was telling you it's very difficult to diagnose TMJ.
Okay.
So we do a couple different things. We can do some digital imaging. So a CT scan is ideal, honestly.
Sure.
That's my favorite. Muscle palpation.
Okay.
And palpating muscles that are intraoral and extraoral. And actually, just if you look at a patient and you see their posture and their gait, you can look at their shoulder height. You can see if their skeleton is off.
Okay.
So between muscle palpation, the patient's description, digital imaging, we typically can get a really good idea if it's a true TMD or TMJ disorder.
Now, doctor, I know you do TMJ disorder, but for everybody, and I know we're recording on both videos, for everybody on Facebook, tell us more about your actual practice. That way, if somebody wanted to contact you, wanted to,
Sure.
talk to you more about.
So for my particular practice, we have the biggest risk factor for us is stress.
Okay.
And malalignment, because the stress causes people to clench and grind their teeth, to wear them down and to shorten the muscles and constrict the muscles. And then when your teeth are not aligned, your muscles are not balanced.
Okay.
So by aligning your teeth, it relaxes the muscles, hence relaxing the joint area, and many patients get relief with that. But I do want to tell you and show you this. This is, we were talking about some treatment. And this is very, very common. I would probably say 50 to 60% of our patients in this practice wear a night guard or an occlusal splint. And what this does is it sends messages to your brain that your teeth are aligned. And so it releases those muscles and relaxes. So it's very therapeutic. And that for patients that do clench and grind because they're under stress, they're grinding on plastic, and not their teeth.
Would that reduce headaches? Because I would imagine the tension it will bring on headaches, so that reduces headaches.
It does, Eddie. I mean, patients that sleep with this and they love it. It's almost like a pacifier because it just really, it's relieving the muscle stress and strain.
Okay.
Yes.
And what do you do in your practice beside clearly TMJ? And is there anything in particular beside even what we're talking about today? If you had to give somebody 30 seconds on what you do in your practice, I know you do cosmetic dentistry and things like that.
We do. So believe it or not, we have a strong backing with the TMD, and we really like to diagnose the complete patient, not just tooth by tooth, but a lot of patients need their teeth aligned to prevent degradation. So we're doing a lot of Invisalign, we're doing a lot of veneers, we're doing what we call full mouth restorations or equilibrations, which have to do all about balance. So a lot of balancing of the bite.
Which is great because not only do I have sometimes clients that have TMJ disorders, they also have chipped teeth because the impact sometimes hit the steering wheel, sometimes the airbags come out. It kind of messes up the face sometimes. So I mean, I imagine those are things that can also dovetail into
You're right.
Into what you offer as well, correct?
Yes.
Okay. Well, I hope you guys found it interesting, and we'll continue doing more educational series. And I thank you very much for your time.
Thanks.
And feel free on Facebook, feel free to send us messages, comments. I'll put her contact information below. That way if you have any questions or if you need a dentist here in South Tampa, she'll be more than happy to talk to you and go forward from there. So you guys have a good day.